Hello guys, welcome to another episode of OPD series. In this session, we will be discussing about the importance of HbA1c. The term HbA1c, also known as glycated hemoglobin, is used as an international standards method for assessing glycemic control in diabetes. It reflects average blood glucose over a period of weeks or months. So, how HbA1c is formed inside our body, or how glycated hemoglobin is formed inside our body. See, during hypoglycemia, there will be non-enzymatic covalent attachment of glucose to hemoglobin. This leads to elevated levels of glycated hemoglobin, also known as HbA1c, which apart from non-glycated hemoglobin, HbA0. This is actually a small proportion of adult hemoglobin that becomes glycinated hemoglobin, HbA1c. And this HbA1c is directly proportional to ambient blood glucose concentration over the lifespan of erythrocytes, which is 120 days, that is 2 to 3 months. So, what we are seeing or what we are checking inside a patient's blood is the HbA1c for the last 2 to 3 months or the 120 days, which is the lifespan of a normal erythrocyte. This table I have taken from the Davidson text, which actually shows the percentage of HbA1c and what's rate in millimole per mole. So 4%, 5%, 6%, 7, 8, 9 and 10. So the normal value of HbA1c comes around 6.5%. So the patient's HbA1c should be less than or equal to 6.5%, which comes in millimole around 48 millimole per mole. See, the difference between the two values is actually 11 millimole per mole. So every increase in 11 millimole per mole will leads to an increase in 2 millimole per mole of glucose. 36 milligram per deciliter increase in glucose. There are conditions where it shows low HbA1c or elevated HbA1c. Low HbA1c occurs in conditions where there is a decreased blood cell lifespan, which includes chronic blood loss, sickle cell anemia, thalassemia, and pregnancy. And the HbA1c is high in conditions where there is increased blood cell lifespan, which include iron deficiency anemia, vitamin B12 or folate deficiency anemia, and splenectomy. Point you are note here is that when the duration of diabetes is short, it is not recommended to use HbA1c to diagnose diabetes. In those conditions, you have to go for the traditional method, that is FBS and PPBS. So the FBS should be less than or equal to 126 milligram per deciliter, and the PPBS should be less than or equal to 200 milligram per deciliter. More than that, we can tell it's diabetes mellitus. One of the extra point is that microalbuminuria. Why do we check microalbuminuria in diabetic patient? Microalbuminuria, which is more than or equal to 30 milligram per deciliter, is an important early indicator of diabetic nephropathy and a risk marker for macrovascular complications.